SaludArte is a first-of-its-kind program for both the Pima County Health Department and the Arts Foundation for Tucson and Southern Arizona.
It was an idea that we had because of COVID to make sure that we could successfully include the artistic community in evaluating and developing a response to COVID that would allow us to really bridge the gap between a community that was tremendously adversely affected by COVID itself and the community of our residents in Pima County. Try to do a foray into combining art and public health and a community-based response.
It's a publicly funded program that brings together public art and public health to answer the question, how might we increase health outcomes for the communities that are in most need through community-centered design, and how might we increase collective healing through public art? SaludArte means literally salud, health, and arte, art. And it's also a greeting that translates roughly to it's a pleasure to share space with you in the Spanish language. It came to be through the vision of Dr. Teresa Cullen, the director of the Pima County Health Department, and her commitment to innovative practices and her understanding that cultural health and supporting cultural health and artistic expression and community collaboration are key means and inroads to increase public health.
Our district was Green Valley, and our project was unique in that we actually got to work with people in creating the narrative for the artwork itself.
Just going down to the basic of being a human, just wanting to be loved, wanting to be heard, wanting to feel supported, especially during very challenging emotional times, especially with communities that are often sort of not given as much resources or ability to connect with other people, especially in the past 3 years.
The whole event was full of this feeling of inclusivity, of a community working towards a common work, a common goal, something that will be on display here at the Community Performance and Arts Center.
I think about 75 people come and paint the mural with us, all ages. We had little kids, adults, grandparents.
Community really care about people that are always looking for a way to make public art more accessible, and in this case, an organization that's bridging health with the arts. So it was just a really beautiful process in that it was a partnership between the artist and the foundation that hired the artist to bring public art to the community.
If you just have an event that's solely focused on health and health resources, it might not be a big draw for people. And so, SaludArte merging both health and art, I think for those people who might not show up to a health event or a health community meeting, the art aspect definitely pulled them in more. And then for those people who, were more into the health aspect or just learning more about health resources, adding in art was like a happy bonus.
The human condition is very important, and my objective was to illuminate it, to make it come in the 21st century, modern, and how, the blues of how it hit us, and it hit us cold, but illuminating us to fight the power of the pandemic. So that's what it symbolizes. As humans, we can endure with heart and soul. This was a powerful project. It made me a better artist.
I've been painting murals for years, and I always have to beg for people, project organizers, to spend more time when I go places to meet people or to have a conversation with someone. And I feel like a lot of those projects, they want to rush me through and just paint something that looks like it represents the community but doesn't doesn't, you know, exhaust all the resources of organizing something, meeting, having people come together. It's just taking time that this project allowed and facilitated for me, and I really liked it a lot. And if I could do every project like this, I would. I wanted, you know, everyone to describe their sense of community and being here, even if it's with people that are gone, no longer with us, or living in another place. I wanted it to be the representation, and then me just to put them together as a community. And I really like that because I feel like I'm not, as an artist, like censoring or trying to make a certain agreeable image. It's just straight from the community.
The first kind of big community project that I've had the chance to be a part of, and it was just like so meaningful to learn all these people's stories and actually see them react to their own face painted or their relatives' faces painted on the pots. It was like very impactful to see that happen.
We will find a way. We will find a way to survive, to thrive, to deal with certain situations. As humans, I think that we have that innate, as some animals do also, right? The process was the people and listening to them and really just feeling like I was just engaged in their conversation. I mean, I ended up talking to someone that I did not know about some very personal, a very personal part of their life that they experienced, and the fact that the way they opened up to me was what I enjoyed mostly.
That moment when you can touch somebody and know that you've touched their spirit is really pretty amazing. There was a moment with the Barbea Williams one where I danced, and for me it was like, oh my gosh, I love to dance, I love to move my body, and to know that I was doing that with people in a community I didn't really know, I had never touched before, literally touched or figuratively touched, was really powerful.
What is underneath all of the SaludArte, what's underneath it and what's uplifting it is really powerful and really meaningful, and that's the part that I want to further participate in and get out to the community. A lot of us are in this survival state, just going from one thing to the next and not really thinking about elevating their personal well-being, you know, mental well-being, physical well-being. And if they knew, like, oh, it's not that scary, like, let me walk you through it, because myself knowing about this, it's intimidating calling a phone number, calling an office, and you don't know what you want and you don't know what you need. So having the health department underneath this and sort of like involved and ingrained, I want to see like that expand more.
So what was interesting was just seeing how COVID had affected us in different ways. You know, some didn't feel like it was really that much effective to them. For others, it was a really big, you know, effect on them. We could come together and turn something that was I don't know if you want to call it, you know, something negative or just a real big impact that a lot of people were really hurt by, and that we could turn it into a celebration.
You know, when I envisioned this work, it was considered fairly radical. We'd never done anything like this before. We combined multiple grants. We had to convince funders that including art and what accompanies art and working with community members would result in an outcome that was impactful. And there were many people that questioned that couldn't see how imbuing our work from an artistic perspective would have an impact on community outcomes, community resilience, community recovery. And I would say that what we've seen is far beyond anything I anticipated even. We had 5 different districts, all of whom are different, all of whom approach this different because these were community-led initiatives, all of whom chose a different artist and a different model of how to incorporate art into what they're doing. And the process itself became a process of healing and recovery. And I think that that is one of the major impacts, that while it was what we sought, I wasn't sure it was what we were going to get. So by working together with the Southern Arizona Arts Foundation, with the communities, with the incredible artists, and with the Public Health Department, we were able to achieve something that was more than any of those parts. I also think it enables us at this point to think differently about how we move forward. How can we leverage the lessons learned, the experiences we had, the impact we saw, and move that forward and incorporate it into further work? So in some ways, if you look at what you want from a grant-funded project, is to have impact in the community, to be able to leave the community with something, and to have gained experience and experiential knowledge that will enable us to go forward and do it again. And that's what we got from SaludArte.